Hello everybody, welcome back to our channel. I have my mama here today. Day after Mother's Day we're filming this, so very fitting, thank you. And for those who are new here, my mom is a dermatologist. She's been practicing for decades.
Long time.
But she's great at it and she knows her stuff. So my friends and sisters and I have always used her knowledge growing up, so we're going to share it with the world. And you guys all asked your questions on Instagram via stories, so we pulled some and are going to answer as many as possible.
Great.
Ready?
Yes, absolutely.
Okay. Do you need to really reapply sunscreen every 2 hours?
Well, that is the recommendation. There are a lot of variables in applying sunscreen. We usually recommend an SPF 30 or higher.
Always.
And it's a good idea to put it on liberally, not sparingly, and that helps to increase its potency.
So for a face, how much sunscreen should you, when you're applying sunscreen to your face, how much should you put on?
Put on like you use a moisturizer. And if you are putting it on all of you, you would use a shot glass full for an application for your
whole
face
body?
and whole body.
A shot glass, all right. Good to know. And so, but you don't have to reapply every 2 hours?
You should.
Okay.
There are other ways you can kind of protect yourself with clothing, you know, a 3-inch brimmed hat, and don't forget your hands.
Yeah.
Yeah.
And what about eyelids? I've heard some people say that sunscreen on your eyes is dangerous. Is that just a chemical versus non-chemical thing, or?
I don't think it's dangerous, but for some people, the eyelids are so sensitive it could be irritating.
Okay.
So you could wear sunglasses if that's a problem for you.
Okay. Good to know. Love it. Let's see here. Would you recommend microdermabrasion or microneedling for acne scars?
For scarring, I would say microneedling.
Okay.
Microdermabrasion is a more superficial process, and I don't think it gets deep enough for the scars, whereas if someone to especially do an aggressive microneedling, you could affect those and smooth those.
Okay. What are your most recommended treatments for acne scars?
First of all, we have to stop the acne. So if you're still getting active lesions, that's important to address because you don't want to get further scars. Then one of my favorite treatments is laser, particularly Fraxel or CO2 lasers. Microneedling can also be done where it's not a laser but more of a physical needling of the skin to increase collagen production.
How long does it take for acne scars to go away with laser treatments?
It can vary from person to person. Usually I like to treat every month or two, and people may get, say, 3 to 5 treatments in general.
Okay, cool. Is it possible to get rid of blackheads, or do they always just stick with you?
So blackheads and whiteheads can be reduced with retinoids. So tretinoin, tazarotene, adapalene, and over the counter there is retinoid and adapalene.
And how long does that take for it to go into effect and you see a change?
Usually about 4 to 8 weeks.
Okay, so you really have to stick with it.
You do, and it's worth it.
Okay. Does your skin get worse before it gets better? Is that something that happens?
In some people who get the acne treatments, it can get a little worse before it gets better. I usually like to tell my patients that I'm treating what's coming out next. And so it takes a bit of patience, but it's worth it.
Ooh, this is an interesting question. Are there any serums that do not mix together? Like if you're having a skincare routine, is there any 2 products you shouldn't have together?
I probably wouldn't mix various acids.
Okay, like glycolic and...
Yeah.
Okay, and how come?
Just because of the irritation factor.
Okay. Maverick has decided to join the interview. We had a couple questions about this one referencing weird spots on stomach and back, and it's called Tinea versicolor. So do you want to address
Sure.
that and how you can fix that?
Tinea versicolor is caused by a yeast type organism called Malathesia fervor. Fun name to say. It's very common and a lot of people just live with it, but it causes your skin to be discolored. And it's usually on your shoulders, chest, back, and maybe upper arms. And if you scratch at the little discolored oval spots, they tend to have a little powdery scale. Okay? So they can be treated with anti-yeast preparations like cyclopirox. Some people use Selsun, which is twice as strong as Selsun Blue, but I guess you could use that as well, and leave that on for several hours. My favorite treatment is to give people a prescription of an anti-yeast medication that they take, work out an hour later, so the medication comes out on their body through the sweat, and they don't bathe for about 8 hours, and it disappears over a few weeks. It's not dangerous.
I've done that one before. She's given me the pill and then the lotion as well, and both have worked for me. Mine does come back, and I think that's part of like a yeast-based.
It's just your body living in harmony with this organism.
I'm just so harmonious with yeast. Me and yeast, we go way back. Should everyone see a dermatologist? I know you might be biased. No. Should everyone see a dermatologist, and how old should you be for your first visit? Like, when is it time to go to the dermatologist?
Well, I think if everyone saw a dermatologist, we'd pick up a lot of skin disease, but it's probably not a practical thing. If you are a high-risk person, though, you should see a dermatologist early on to get skin checks. And risk factors include being fair-skinned, having somebody in your family with melanoma, having multiple sunburns, and also being a very moly person, maybe having more than 50 or 100 moles on your body. So these people are at higher risk and should get checked. And I would say start in your 20s for a yearly skin exam.
Good to know.
Yeah.
Okay, I'm going to ask kind of a generic question. For somebody in their, let's say, early to mid-20s, what would you recommend as a skincare routine for them?
This is something that really needs to be more individualized. It's hard to do a blanket recommendation because people have different types of skin. Some are dry, some are oily, some people have acne or rosacea or melasma, so it's very difficult. I usually suggest, though, in the morning using a moisturizing sunscreen and perhaps a antioxidant like the vitamin C's and E's. And in the evening, I usually like to get started with a retinoid, like Retin-A or over-the-counter Retinol or a Dappling. And then a moisturizer again at night.
Okay, so pretty simple.
Pretty simple.
Should we be double cleansing every night when we are washing our face?
I don't see a need for that. Our bodies help to debride our pores naturally, so I would treat the skin gently. Sometimes over-cleansing can cause dryness and irritation, so you mainly really want to remove that makeup.
Okay. And then what about exfoliating? How often should you exfoliate your face?
What do you use to exfoliate?
Like a gentle exfoliator that has some just kind of texture to it?
It varies. If you're on acne medicines, they are probably going to exfoliate you, and you probably don't need to do that at all. But if you have a lot of pigment from melasma or freckling or sun damage, then you're going to want to exfoliate more often.
Can you exfoliate too much that it hurts your skin?
Well, you would notice the irritation if you did.
Okay. We got this question a lot. I didn't realize we have so many soon-to-be mamas in our followers, but what is a great alternative for retinol for pregnant women?
I don't have one. I think I would just stay away from that. There hasn't been any known risk factors to using a topical retinol when you're pregnant, but it is in a category that is very bad for pregnant women. So it's just, we cannot do these studies on pregnant ladies, so we just have people avoid drugs that we think would not.
Better safe than sorry.
Better safe than sorry. And a lot happens to your skin when you're pregnant. So.
How do you reduce or entirely remove sunspots altogether?
Well, you can reduce them with bleaching creams, which usually contain hydroquinone or kojic acid. There are some over the counter, and there's stronger ones by prescription. Exfoliating with a retinoid also helps in combination with that. And beyond that, there's many procedures, particularly lasers, that can do a fabulous job of reducing those brown spots.
It all comes back to the lasers, doesn't it?
They are fun toys.
I love that. Oh, this is an interesting one that I hadn't heard previously, but we had a couple people actually ask this question. Will Botox weaken your muscles over time? And multiple people had said, will Botox leave your skin saggy after a while?
When you don't use muscles, whether they're paralyzed or you're just lazy, your muscles will atrophy. In other words, they'll kind of shrink.
Interesting.
Yes, so that can happen with Botox as well, but it doesn't make your skin saggy.
What is your thoughts on preventative Botox and people in their young 20s getting Botox?
So the ideal we want is to not have wrinkles, but yet use facial expression.
So my mom gave me Botox.
But people who are young have that ideal already. So when we use Botox, people lose some of their expression. So I would just enjoy your face when you're young and you don't have many wrinkles, yet you can still raise your eyebrows and smile with your eyes.
Yeah, you've given me Botox twice now, and I just started this year, and I feel like it's when I started to actually see the wrinkles come in, and then when you gave it to me, they completely disappeared. So that was always my question with preventative Botox is it fixes it anyway, so why do you need to prevent it early on? It just doesn't create the wrinkles in that case?
I think it's a waste of money, really, because I would wait till you have wrinkles at rest.
Well, that's what I was saying, like mine. Okay, so I know I'm still fairly young and I just started Botox, but I was starting to get just a subtle line in my forehead and in my 11, so I had my mom give me a little bit of Botox. She slayed. And now that's completely gone. So with preventative, they always say so you don't have the wrinkles later on, but Botox gets rid of it later on. So it seems kind
You're
of...
going to have to continue to use it
Exactly,
later on
so it's
anyway.
almost a little redundant. I know I'm not a derm, but that's just my opinion.
I would wait till you have wrinkles at rest.
Good to know. Okay. All right, we had a lot of questions on filler. This one, what are your thoughts on filler and face movement? Is there a particular brand that you like more than the others?
There's many choices now, which is wonderful. I like the hyaluronic acids personally because patients leave and can see the effect right away. There are some that last for a year and a half now, which is much longer than it used to be. And they have different densities, so there are softer ones for the lips, stronger ones for on top of the bone, and things can be treated very naturally.
How do you minimize redness and splotchy areas?
In some ways, it depends what the redness is due to. So it could be due to sun damage, to rosacea. So if you have rosacea, for instance, you should probably go get that treated, especially if you have breakouts with the redness. Sun damage or the little broken vessels can be treated with laser. There's also a topical medication that will reduce the redness for a day at a time, but that's a prescription.
Oh, this is a specific one for pimples or acne around the hairline. How do you tackle those?
I would treat that in a similar fashion that I treat other acne, but the acne around the hairline is often due to people using products in their hair that might be a little oil-based.
Interesting.
So I would avoid those.
Okay. What are your recommendations for chest and back acne? So any body acne?
So I find it very difficult for my patients to put creams and lotions on the back, though I always say that that is perfectly appropriate. It's just cumbersome. So when I see people having a lot of widespread acne, I will usually treat with oral medication as well.
Okay, like a pill that you can just
Yes.
pop? Interesting. Are chemical peels actually worth it?
Chemical peels are great if you have a lot of sun damage and want to help improve that. It can help with the brown spots, and sometimes if you get a very vigorous chemical peel, it can remove some of the rough spots as well from sun damage.
What about melasma? Can it help with that?
It has been used a lot with melasma. I find in my office I'm using more laser devices to treat melasma or microneedling.
Okay. I'll ask a separate question for that then. What is your recommendations to help with melasma and hyperpigmentation?
So with melasma, first, it's very responsive to light, sunlight, and perhaps even indoor light. So strong physical sunscreens constantly is important because it tends to come back with a vengeance. It's very difficult to make it go away for a long period of time. But I use a combination of retinoids and bleaching creams, sometimes topical steroids. Then we will gradually increase treatments with lasers, microneedling.
This is a very generic question, so there's going to be a lot of answers, I'm sure, but how or can you reverse sun damage?
This is what we always try and do. So I do like people to use some antioxidants, particularly serums with vitamin C and E in them. Also at night, I like to use retinoids. Over the counter, there's Retrinol, and then there's stronger versions by prescription, tretinoin and tazarotene.
Okay, that's actually was another one of the questions. What's the difference between tretinoin and Retin-A or retinol? Is one better than the other, or is it just intensity?
Tretinoin, they're both derivatives of vitamin A.
Okay.
Tretinoin is going to be considered a little more strong than Retrinol.
Really? I always thought it was the other way.
No.
I think I've been spreading false information.
But some of the Retrinols can be quite effective as well.
Mm-hmm. And most of them are just over the counter, correct?
The Retrinols are.
Okay.
Tretinoin is a prescription.
Okay. Tretinoin is what you gave me to use.
I believe
And the
so. Yes.
Glycone, is that the brand?
Glytone is probably a Retrinol product.
Okay.
Yeah.
Cool. Good brand though. She sells that in her office and I really like it. Okay, let's see here. Are there any ways to treat a double chin?
Oh, absolutely. There's a couple. One is a cool sculpting laser that helps to dissolve your fat. And one is an injection by a drug called Kybella, where it also causes the fat to be destroyed and go away, and it has a permanent effect.
How quick, are they instant?
No, they take about 4 to 8 weeks, and usually it's more than one treatment.
Okay, but then it's permanent.
It is.
Wow, that's cool. Is there any way to treat excessive underarm sweating?
There is. This is one of the number one most problems in dermatology that a lot of people don't seek help for. There is a new prescription topical medication that can be used, but one of my favorite treatments is to send people for a melting of the sweat glands under the arm with a device called Dry. It usually takes 2 or 3 treatments and it's permanent.
And so you don't sweat there at all?
No.
Can you do that anywhere in your body?
No.
Because I would love to do my upper lip.
Sorry.
I think you need to work on that. I'll take the armpits. I need the upper lip. How long should you give a new skincare routine or product a chance before deciding if it really works or not?
It takes a while, so I would say 4 to 8 weeks.
Okay, and is that starting gung-ho, or do you think they should start like in a certain spot and then do it, or do you think you can just straight up go on your face with the product?
It depends how sensitive you are. In patients who have a lot of allergies or are very sensitive, I suggest they do an open use test, which is put it on your wrist twice a day for about a week. And if you don't have irritation there, then go ahead and try it on your face.
Okay, but in general, 6 to 8 weeks you said, or 8 weeks?
It varies for products, but yes.
All right, wow, that is a long time. You really got to commit. Let's check some of the ones that you guys just put in today. We put up a last minute question box, so let's grab those suckers and see if there's any more that aren't on the list already. What is the difference between chemical versus mineral sunscreen?
So mineral sunscreens are titanium dioxide or zinc oxide, and these are the ones that are kind of pasty and hard to rub in, but it's like putting on a shirt. They're not absorbed. A lot of people like this who are worried about the absorption of chemical sunscreens, which do go through the skin, have a little reaction that helps you prevent being sunburned. It has been found in very minuscule amounts in the body and breast milk, but we've never yet found an adverse effect from that.
Okay, interesting. So is it marketing that makes everybody freak out over chemical sunscreen? There's not actually really a big issue for it?
It's something we need to continue to do research on, but as of today, it has been looked at and there aren't ill effects from the fact that we get that minuscule absorption.
What about if you're pregnant and breast milk and anything like that, it's sinking into there?
Again, we haven't found any ill effects, but if you're worried about it, just use the physical sunscreens.
When it comes to melasma, do you recommend physical sunscreen or chemical sunscreen?
I would recommend both, but the physical sunscreens are great because that would block out multiple kinds of light.
How do you get rid of spider veins on the face or on the body? And also maybe explain what spider veins are.
Okay, so spider veins are the super tiny red veins on the face, and those can be removed with laser.
Okay. Any other way? Any topical form or no?
Not really.
And how long would those laser treatments take?
It varies from person to person, so it might be 1 treatment, 2 treatments, 3, and usually I treat about every 4 weeks.
Is it permanent once they're gone?
It is, but a lot of people will get more blood vessels with time, whether they treat or not.
Okay.
And on the legs, it's often treated with injections if the blood vessels are big enough. That's called sclerotherapy, but we use lasers on the legs as well, especially for the very tiny vessels.
All right, well, thank you, Dr. Fisher, Derm Mom, for letting me ask you all these questions and answering all of your guys' questions. I love doing these videos, and I'm very proud to have such a smart mama.
I'm proud of you too.
Oh, thank you. She's really helped me my whole life with my skin and obviously everything else, but having a derm is very handy. So happy that we can help you guys with your questions, and grateful that my mama will do it for us and for you guys. And if you guys like this, please comment. We can film more of these for you guys. If you have other questions, leave them there. I have an ongoing list for whenever I'm with my mom and force her to work and record these videos with me. So
it's my pleasure.
So please leave it down below and let us know if you want to see more of these videos, and subscribe. Thank you.